Hello, everyone. Welcome again to another episode of Read 21. We're so glad that you joined in with us. And as you know, literacy is involved in every aspect of life, every walk of life. So, no matter what career you have, you are required to read. And so, today we have a new guest. Her
Okay.
name is Gwen Benford.
Hi.
Hello, Gwen. How
Hi.
are
Hi.
you?
Hi. Fine.
Good. Well, Gwen is a career nurse and she has lots of information to share with us. And we want to tap into how literacy was important when she worked as a nurse. But
Okay.
before we go there, let's find out who Gwen Benford is. So, Gwen, tell us about yourself.
Okay. I've been a nurse for over 20 something years. Um, my career ended I've worked in all aspects, such as primary care. I've also done agency contract work with like nurse finders, but I ended my career in OBGYN. That's where the majority of my work has been. I was a triage nurse there for over 15 years. So that's
Oh,
where
wow.
basically where
Well,
my
you said some words that some of our audience may not be aware of. So, you mentioned that you did primary care initially. What
yes.
does that mean to, we know the word primary means first, but what
Right.
does it mean in the medical terminology, primary care?
Primary care it is mostly with family care. That's where you're seeing all aspects from pediatrics on up into adult age. So that's
Okay.
what primary means.
So that
You
does
see,
that mean like when we go to the doctor for our normal visits, or if we have a cold, or just general things, or your kids are getting shots, would
shots.
those be considered primary care?
Those are considered primary.
Okay.
Exactly.
Okay.
Exactly.
And now tell us about the other aspects of nursing that you were doing. Would you
Well,
explain to the
then,
audience what
like
that
I
is?
said, majority of my career ended with obstetric and gynecology, and you probably heard it by OBGYN as a short abbreviation for it. And that's a specialty. That's when you go and specialize in a certain field. So that's where I ended, and I became a triage nurse there. So, and triage is where incoming calls are coming in. They're non-emergency and emergency calls that I handle for the office. And also going over lab results, educational training, providing patients with lab results, providing them with post op and pre op care information for the doctor. Before the triage nurse, I did work with the doctor specifically and doing patient care, providing shots, doing labs, doing procedures before I actually went to foam nursing. I was on like a floor nurse. So, yeah.
Okay. And what do you mean by a phone or a floor nurse?
Well, when you're working on the floor, that's when assisting the doctor with procedures. You're giving patients injections. You setting up for procedures for patients to have. We did a lot of in-office procedures and stuff that was done. You're learning about crash cart care in case non-emergency situations occur in the office. I have to know how to use a crash cart. You are trained in that so situation. And then as I advanced, I went to triage nurse since I had those skills to be able to educate patients in non-emergency situations and emergency situations. So,
Okay, interesting. And as a triage nurse and as one that worked in the clinics, how would you know what you needed to do for each patient? How was that information transferred over to you?
well, each patient, well, education, training, that's from reading and studying, going to classes. you Reading is very essential in life, like you said, all aspects of life. So once you enter nursing, you never stop learning. You're always going to classes. You're always updating your skills. You're always taking more training classes. So it's every year we go through training classes. We go through CPR classes to keep us updated. So you always updated on new information that's coming out. So it's a learning, you're learning all the time and you're always reading. So you got to be able to comprehend what you read and be able to apply it to your job. All our patients are treated. When I'm triaging, I have a patient's chart in front of me, information. So you got to be able to read through their information, decipher what's important, what's not, and give them the right information on whatever their problem or situation may be. You got to be able to train to explain that to them. So, like I said, you really need to be really educational, on that, and compassionate. You got to be compassionate
Yes.
and with patients, but you really need to know your skills, especially when you're triaging. You really do, and
Yeah.
it's continuing education all the time. So.
Would you say that a lot of the words in the charts were pretty big words, or were they mostly basic words?
You learn well the basic skills you will learn, but there are going to be some big words. And what do? You either consult with a physician to make sure you're proceeding in the right direction, or you can also make sure you look it up or consult with someone to make sure that you are proceeding in the right directions. But there's always going to be challenging words in there, and but as you in your career long enough, you know how to decipher those things. You've learned those along the way, building your vocabulary. So
Yes, I would say that it's really important to be able to decode what we
right,
call in the education world multisyllabic words.
correct,
So if a word has all these big prefixes and the root,
right,
root word is really big and it has a large
hmm
suffix as well, like a hypoglycemic,
right,
being able to say that word and not just get to something every time and wonder, okay, what is that?
correct.
Because if you read it wrong, could that cause you to do the wrong thing to the wrong patient?
Actually, it actually could, or proceed with the wrong medication
Oh,
for that
yes.
patient or anything if don't really know what it means. So you have to break it down, and usually when you're learning those things, they teach you that in nursing school. You know what hypo means? Low, glycemic, blood sugar. So you do learn how to break those words up and know how to decipher what they are. So, and know what they mean. So, yeah.
That's really
So
good.
hypo is low, hyper is high, glycemic pertains to blood sugar. So that helps you too. But you really need to know how to read. And when you're in nursing, you really need to read things more than once, especially when you administer medication. They always say the 3-5 rights of reading those things. If read it 3 times before you give it, and make sure of what you're giving, because some words sometimes can look the same
Hmm.
when you pull in medications, but they do different things. So
Oh,
you
wow.
got to be really careful about when you're reading the medication and make sure because sometimes we moving really quickly in medicine. Sometimes if it's an emergency situation, and if it is, you really should slow down and read. Take your time and read it.
Wow.
And that's
Reading.
even when you're triaging a patient, read through their chart thoroughly. Make sure you understand what you're reading. If you're not sure about something, sometimes deciphering some of the doctor's writing, that's another different learning of its own. But you really need, if you're not sure about something, then you need to consult someone. You really do. Because
Wow.
this is somebody's life. You don't want to give the wrong medication. You don't want to give the wrong information to someone when you're providing them with lab results. You want to make sure what you read is correct. You want to make sure you're giving them the right information because that can create an issue too.
Wow. That
Yeah.
sounds so important.
Oh, it is. It is.
I
It
know
is.
reading is important in a lot of different
Hmm.
areas, but
Yeah.
when you think about medicine,
Medicine.
it really can mean the
Hmm.
difference between life and death.
Right.
And
Right.
I was listening at you with the hyper and
Hmm.
hypoglycemic.
Yes.
It made me think about what we offer with our critical thinking piece. In the
Hmm.
beginning, we offer root words. We're teaching the kids with
Oh,
root words, prefix, suffix,
oh,
so they
okay.
can understand those meanings to help them
Yes,
comprehend different things. And
yes,
and who would have known? Here it is in nursing;
yes,
those things are important as well to be
yes,
able to do that.
yes,
Now, when you went,
yes,
I know it might have been a little while because you're enjoying pickleball and
yes,
traveling and all that in your retirement stage.
yes.
But when you went to school,
Mhm.
would you say that did you have to do a lot of reading when you were
Oh,
studying
yes.
for your coursework?
Oh, yes. Oh my gosh. Yes. It's kind of like you really have to buckle down. Yeah, reading, it's reading the whole time there. Biology, anatomy, learning the different parts of the body, learning the different parts of the systems in the body and how they work. That really helps you knowing about medication, treatment, diseases. So you learn about the different diseases, how to treat them, how to recognize them, the different diseases. So yeah, it was a lot of reading, memorizations, but it's a lot of reading in nursing. You really
Yes, and it
you,
sounds like critical thinking is
and
so
critical thinking,
important.
correct.
Yes, because once you read it, like you're saying, you're
You got
having
to apply it.
yes.
Hmm.
And that's where that comprehension and critical thinking comes in.
Comes in, right?
So many kids are missing that today, and I
Yeah,
hate it for them.
yeah, yeah.
But that's part of what we offer,
Oh,
offering a way
good.
to help increase that. So we offer fluency. We have two portals. We
Oh,
offer fluency for students that can't read,
oh,
and then
okay.
we offer critical thinking for kids that can read. So once you
Oh, wow.
do know how to read, then we want to help you strengthen your vocabulary
Hmm.
and be able to dissect comprehensive passages and words that are unfamiliar to you. Because
Right, right.
when you're going into fields like nursing,
Hmm.
you're going into the medical field altogether,
Hmm.
pharmacy. Did it take a while to get that patient back to the right status? Like
I,
when you have
I,
them come in on a triage situation, they might
yeah.
have taken something at home
Oh,
and
yeah,
they come in and they don't know
yeah,
what to do. And
yes.
you guys are trying to figure out, okay, how to counteract those type things.
Now
What
we
has been your experience with that?
now we've had a situation. I could just only mention this one situation where reading is very crucial, and
Hmm.
we do educate our patients whenever you prescribe a medication. We educate them, and I'm sure when they go to the pharmacy, they educate them too. But we we have had a patient something that was used supposed to be used in a different area. I'm trying to see how to say this.
Yeah, like
It's like a suppository, and it's
yes.
supposed to be used a different way. And I don't know if this patient just didn't read it or didn't comprehend it, but she was swallowing it.
Oh my
And the
gosh.
pharmacist notified us that the patient had been taking medication incorrectly.
Wow.
And that was a little alarming to us. We all of us were like we never seen anything worth, and we were really trying to figure out how did she get that down? How was she swallowing a suppository the size that it was? But she had been
Yeah.
taking it wrong for three days. Yeah,
Oh my gosh. And do
yeah.
you
So
have
it's very important to
yeah,
read
you
everything, and
mentioned
if you're not sure, ask someone. But it's very important to read your
and
labels.
you know
Read it.
what? I can see that affecting people in so many ways. Just even
Yes.
if they just go get a bottle of Tylenol
Right.
uh, off the store shelf or cold medicine or
Right.
whatever it is, you still need to be able to read and
Read it.
understand what it
Right.
is. What is what's the dosage amount?
Dosage. Hmm.
And are your kids old enough to take that particular
Take
medicine?
right. Right. Right.
Yes.
Yeah, but this
You
lady
said,
was older, so
oh,
she
wow.
she was, you know, I don't know why she, I don't know, why she
Well,
would.
Gwen, we have found that there is a large percentage, we're talking about millions of
Mhm.
adults in America that cannot read. And a lot of them are older,
Mm,
unfortunately.
mm,
Some people have had the just the unlucky situation where they grew up in an area where there weren't schools because they had to farm or
Yeah,
they had to
that's
do
true.
other kinds of work. And then, of course, over our country's history, there were times where blacks were not allowed to go to school or not allowed to go to certain schools. And
Hmm.
so, until the 60s, we really didn't start seeing a push for education for everybody in America. So when you look at it that way, it hasn't even been 100 years
Oh,
that
wow.
Black
Yeah.
Americans have been able to have a good education.
Wow.
And
Yeah.
it's amazing how something like that, is still shown in our
Hmm.
country today
Yeah.
when you think about things like that.
Yeah.
Taking a suppository
Tori.
orally through your mouth
Yeah.
instead of through the other part of our body where it's
Right.
supposed to go through.
Be.
And
Right.
thankfully,
Yeah.
it didn't kill her. It didn't,
Right.
put her
It
in the
wasn't
hospital.
anything. And and it was caught by the pharmacy early, and he notified us. So, yeah.
That's good.
But we really, with nursing, you really try to make sure patients understand before they leave an office or medical. Well, I don't know so much as the hospital. They really give you the discharge sheet with all the instructions on there. But we really try to make sure if it's in the office setting that they understand how to take it, when to take it, or what it should say on there when they pick it up. And the pharmacist is there too. They always, it's like they reiterate too, making sure. So I'm noticing that a lot in the pharmacy. If you pick up your medication, you move to the pharmacy first and they go over everything and ask you if you have any questions. So maybe they had been seeing a lot of patients that were maybe taking things incorrectly, because this is kind of a new uh, thing I've seen them doing lately.
Yes.
It's
Yes,
just,
that's amazing that
yeah,
pharmacist picked up on that, but thank
yeah,
God for
yeah. I
that.
don't know if she called or if someone called, or, but I just remember they notified us of that. Just
What,
wanted to let us
what would
know.
you say to young people right now that has an aspiration to become a nurse?
Oh, I think it'd be
What would you
great.
say to, do you think that's a field they should go into? And if they do, what kind of work should they be focusing on when they're in high school? What do you think?
Yeah, if you're compassionate, understanding, you like providing care to others, because it's not always, glamorous, you know, situation. People think, oh, nurses is glamorous, but you really need to be patient, compassionate, and want to provide care to people. So, I think it's an excellent field to go into. I think that it's rewarding, to see that you're making a difference in other people's lives.
Hmm.
Health wise, for its education, because not everyone, if there are diseases that they may have, if you can educate them and see their progress and them understanding, it's rewarding. It really is rewarding. So if your student is likes to care for people, compassionate, I would say go for it. You do need to have your reading skills up. I'm going to tell you that your reading, your writing, and your mathematical skills. Because, like I said, you will be dispensing medication, and you really need to know what you're doing mathematically, too. I know most of the stuff is already pre measured, but you want to always read through it and make sure is this pre measured correctly.
Hmm.
Um, and you're the one that should always give, if you're the one providing care for someone, you're the one that should always dispense the medication. Never dispense something someone else gives to you, because if they hadn't read it correctly or hadn't drawn it up correctly, or you're going to be the one responsible for whatever goes down. So you always protect yourself. If you're treating them, then you need to follow through with the whole care of that patient, dispensing medicine, writing it up, charting it, and all that. So you never let someone else give something that you're responsible for, and
Yes,
that they do teach you that in nursing for sure. Yeah, you never.
that makes a lot of sense.
Yeah,
Of course,
because
going back to reading and understanding
yeah,
what
you need to read, understand. because there's labs you're going to be reading, there's charting you got to do. If you're dispensing insulin, you're going to have to chart that. So you need to be able to read those labels, know how much you're giving, how much to give. So yeah.
This is very interesting.
It is interesting, and it's fun, and it is interesting, and it's rewarding. It really is, and you learn a lot. You learn a lot, and you can specialize in any area that you're interested in. There may be someone that loves pediatric. You can provide pediatric care, and that's your specialty. You may love OBGYN, that may be your specialty. I've been in some deliveries. I've gone with the nurse practitioner or the doctors to deliveries and stuff and seen the little ones, being born. So you may want to go be a labor and delivery nurse in the hospital. It's just a variety of fields you're gonna. You may want to do physical therapy, or you may be nurse practitioner, or you may just want to go higher and higher. So it's just an open field for any area that you may be interested in. So that's the one thing about it. You don't have to just specialize in one area. Go
yes.
with where you like. But when you do start out learning, you are going to have to learn the basics. So, yeah,
Well, this is really interesting.
it is. It
Thank you
really is.
so much for sharing with us, Gwen.
Oh, you're welcome. You're
Thank you for
welcome.
sharing with our future nurses of America.
Yes. Yes,
And not
yes.
just America, but the world. Because
World.
kids can, grow up to be nurses anywhere, be where you
Right.
want to be, and be
Right.
what you want to be.
Yeah.
And everybody, as you heard all along, literacy is important in
Yes.
every aspect of life.
Life.
And it is crucial in nursing to know
Yes.
how to read and comprehend.
Yes. Yes. Yes.
And
Yes.
thank you, everybody.
Thank you for educating them, educator, because you guys are where they start to get the education and the learning, and so we're, grateful for you. I had an educator, so in nursing, so
Thank you. Thank
yeah,
you, Gwen.
yeah. Thank you.